So we're really grateful to Isaac for that really interesting presentation. We're glad he was able to record it a couple of days ago when his internet connection was a little bit better. It might be a little bit spotty today, but we're really glad that Isaac is with us right now. And we're gonna have a time now to do a bit of a Q&A, particularly if you have questions about Isaac's presentation or about the work that's going on in Ghana. We'd absolutely want to have those questions and take advantage of Isaac's presence with us. You can either put your questions in the chat, as Emma mentioned, or unmute yourself and ask your question. But I'll be kind of facilitating the process. So if you put your question in the chat, we will get to it. Like I said, we want to make sure that Isaac has the opportunity to answer any questions. But if you have other questions related to PWS&D's work, we know we had one question come up this morning that we said we'd deal with this afternoon. So we'll also try to answer that one. Because we have other staff here as well. So if you have other non-Ghana questions, feel free to ask those too. So we'll open it up now for any questions that might be out there. Okay, so Isaac, there is a question here about why the CBR program chose the 6 districts in the north as the project districts.
Okay, thank you very much. I must indicate that the program began as a result of onchocerciasis, which is otherwise known as river blindness, that became so common in northern Ghana. And actually, onchocerciasis affected those 6 districts. It was pronounced in those 6 districts. And that's how come the program is covering those areas. And so the Presbyterian Church started the CBR just to address onchocerciasis from the onset, as I indicated. But currently, you know, onco is no more there because of the interventions we have done. But they still need to continue with the program in the way of community-based rehabilitation and then supporting persons with disabilities in general. And as indicated, is due to resource limitation. If not, we could have gone beyond the 6 districts, maybe to cover more areas in Ghana. So in short, I think this is the response I have in respect to that.
Thank you. There's a question now about COVID vaccination supply. I'm wondering if you could talk a little bit about what the vaccine supply looks like in Ghana right now.
Yes, the supply of the COVID-19 vaccines actually is a challenge. Government was able to order for some vaccines, but they were not enough. And so the few that arrived, some parts of the population were able to benefit from it. They have started with the vaccinations. Even though I indicated in the presentation, we have this challenge of you know, misinformation regarding the side effects of the vaccines, and some people are scared, they don't want to go in for it. But I think that currently, those who are enlightened and they are well informed about COVID-19, they have gone in for the vaccines. And government at a point ran short of supplies. But currently, just last week, we got the information that they have ordered and that some more vaccines have arrived. And so they are going to continue with the vaccinations. In Northern Ghana, only a few people have actually benefited from the vaccine so far. And we are expecting that the arrival of the vaccine this time, the government will channel a lot of them to Northern Ghana, so that all of us, including my good self, will take a jab. Thank you.
Thanks, Isaac. Teresa, your hand is raised. Do you want to unmute and ask your question?
Yes. Hi, Isaac. It's wonderful to be able to meet you from this distance. Many years ago, I was able to visit Garu and the Rehabilitation Center, and it's truly an inspiring program and project. And I think the community-based aspect of it is something that we here in Canada need to emulate what you are doing there as well. I have a daughter who has a disability and she uses a wheelchair. And I was wondering, I know a lot of your programs are for adults and getting them income generation projects. What is the situation for children in Northern Ghana with disabilities and in terms of their access to school and other programs?
Yes, actually, like I indicated, I wasn't doing a comprehensive presentation of CBR, but when you look at the CBR program, we have a component that is looking at inclusive education for children with disabilities. And the situation here in Northern Ghana actually is the case of some kind of discrimination that is going on, where some parents will feel that children with disabilities must not be enrolled in schools, they must not be given the opportunity to go to schools, just like other able children. And so our inclusive education program reaches out to families of children with disabilities and try to educate schools. We have an officer and he has been identifying and enrolling these children, and they are well integrated. We have quite a good number of them who are in schools now, and they are learning. And so we need to continue to go into the communities to educate them about the fact that when you have disability, it doesn't mean that it is an inability. You can have disability, and yet when you are given the opportunity to learn, you can excel in life. And that is exactly what we have been doing. Thank you very much.
Okay. Isaac, Guy was talking about the fact that, the Garu CBR program has demonstrated really great results. Has the work that you've been doing with the CBR program helped inspire other places or people to run similar programs?
Oh, yes. The fact is that because of the interventions we are doing, a lot of our clients actually are doing so well in the communities. I mean, those who have benefited from the CBR interventions. And so they are serving as a point where instead of our officers doing a lot of the work, it is actually our clients who are taking up some of the interventions in their various communities. We have had to also initiate some activities in the area of savings and loans. And some other organizations have emulated this. And that particular intervention, we call it the community savings and loans. It has gone so far, and it has helped a lot of communities and other organizations that are into poverty reduction. They are adopting it and also training their clients. And I think that the achievement of that particular intervention is phenomenal. And I must indicate that it is good that we got the support from PWS&D to be able to carry out those interventions. Thank you.
Thank you. I wonder if you could talk a little bit about maybe some of the work that you might do in, maybe it happens or maybe it doesn't, in collaboration with the government to address issues related to stigma and discrimination for people with disabilities.
Yes, for the collaboration with government, the CBR program, we actually have some kind of collaboration. And so what we are going to do is we will strengthen the collaboration we have to make sure that we are able to educate communities more about this stigma. The government of Ghana actually has in place some provision from the Common Fund, the Development Fund. They call it Disassembly Common Fund, which they have earmarked some percentage to support persons with disabilities. And so what we are going to be doing as a CBR program is to strengthen our collaboration with government to make sure that those funds are used well. Because we have realized that in some of the areas, even though the fund is existing, the assemblies are not able to identify those who are mostly, the hardest hit in terms of poverty, to be able to help them through the fund. And so when we strengthen our collaboration with them, we will ensure that the fund is utilized effectively and efficiently, whereby it may not be channeled into wrong hands. We have had instances where in some of the assemblies, we got to realize that they rather supported wrong persons. They rather supported wrong persons because they channeled the funds into supporting those who are not persons with disabilities, but of course are in need. But the fund is supposed to actually support persons with disabilities. And so what we are going to do is we will strengthen our collaboration with the assemblies to ensure that this fund is made more accessible to the most needy persons with disabilities in our coverage area. We will also continue to strengthen collaboration with the Ghana Health Service. We have been collaborating with the Ghana Health Service, and we will strengthen collaboration with them. We will strengthen collaboration with the Ghana Education Service to ensure that children with disabilities are mainstreamed in schools. They are enrolled in inclusive education settings so that they will be able to have access to formal education. And all other agencies that are operating in our coverage area, we will be strengthening collaboration with them to ensure that we are able to continue to do our work effectively. Thank you.
Thank you, Isaac. We absolutely can take more questions. Feel free to raise your hand or unmute, and I'm gonna try to spot if you wanna ask a question, or otherwise just jump in. In the interim though, Isaac, I wonder, you spoke a lot about challenges, which is obviously much of what you're dealing with right now, particularly in light of COVID-19. But I wonder if you could talk about something right now that is giving you hope as you look to the future. Something that's inspiring right now.
Yes, our hope actually is on the fact that we are using the user-led approach to development to do our work. So the fact that we are able to involve persons with disabilities in the program and to equip them and to train some of them into self-help groups and disabled people organizations and to empower them to engage in advocacy and etc. We have the hope that one day, some of them have already started, carrying out a lot of, sensitizations and advocacy in the communities themselves against negative attitudes and discrimination. So our hope is that they will continue to do this going into the future. But what inspires us most is when you are able to support persons with disabilities out of the scanty resources we have, and then you see them bounce back and they are able to get integrated. It is so inspiring and heartwarming. It helps us to fulfill the gospel. The gospel says that I came that they may have life and have it abundantly. And you can find this in John chapter 10, verse 10. Christ said this, and I think that with the partnership we have with PWS&D, we are fulfilling this practical ministry because of the interventions we are doing, persons with disabilities are having life. And not just having a mere life, but they are having it to the fullest. And that is what is heartwarming and inspiring. And I think we must continue to do this, bearing in mind that Christ himself has taught us to love. And love cannot be complete if we do not love persons with disabilities. They are part of the population, and our love will take the form of what we are doing. And we need to inspire ourselves, regardless of the challenges, to continue to do our best to support them to have improved lives, and for that matter, to fulfill the gospel. God bless us as we do this. Thank you.
Thank you for that, Isaac. I think it's really fitting that you quoted from John 10, which is also what forms PWS&D's vision statement about God's promise of abundant life. And that's what inspires our work as well. It's what keeps us going in the work that we're doing. We have time for more questions. If people have questions, again, drop them in the chat or feel free to unmute and ask. Absolutely questions for Isaac, but if you have other questions related to PWS&D's work, we've got other staff people here who could always answer. If you have another question, this is your time to ask.
I have a question about COVID-19 and the use of masks. You might not know this, but here in Canada, there are people who resist wearing masks. I wondered, and then I was wondering about the availability of masks in Ghana. Maybe can you talk to us about that?
Okay, yeah. I think the challenge in Canada, and for that matter, Ghana, they are not that different. We equally have those challenges here in Ghana, where some of the clients are not ready to wear the mask. And many people are resisting the wearing of the mask. So at some point, the government had to use force. The government had to start to penalize people and force them to wear the mask. And I think that is a serious challenge, and we are working on educating them. They shouldn't see it as something that is a punishment, but it's for their own good. And that's the kind of message that we are actually using to be able to educate a lot of people. But it's not everybody who wears the mask, actually. Many people do not like wearing the mask. They are resisting it. So I think that is the same challenge over here in Ghana. Thank you.
Isaac, for people who want to wear masks though, are they accessible? Can people get them?
Yes, actually the accessibility of the mask, if you avert your mind to the presentation I made, you realize that the mask is actually not accessible to everybody, and is available in the market for sale. But people with disabilities, because of poverty, some of them are not able to afford. And so what the program has been doing has been to ensure that through the support we have from your end, when we are engaging the clients, we supply them with masks as well, so that they will be able to use that to protect themselves. So apart from persons with disabilities who are very poor, and some of them, because of they cannot afford, many people who actually wants to buy the mask and put the mask to protect themselves, and they have the economic capacity to do so, they are able to get them in the market. They are available in the market. And I think the commonness of them, I'm going to show you, that is very common in the market now. And that's what we are using. This one, can you see this one?
Mm-hmm.
This mask is very common, very, very common. And I have a packet with me in the office. I make sure that when the clients, they come to the CBR office for services and they are not in mask, I just remove some to give them and to encourage them that they need to always wear the mask. And other thing is that we are encouraging them to use, this one is a disposable mask. You know, after using this, you need to dispose it.
Mm-hmm.
But what is happening is that persons with disabilities and other poor people, they are not able to afford to buy a mask that they can always dispose it. And so we're encouraging them to use the local material. And with that one, you can use it for some time, and then later on you can wash it after the close of maybe the day's work. You can wash it and dry it, iron it, and then you can use it again. And that has been very helpful. I think that that particular strategy we have used is actually helping a lot of those who are not able to afford the mask. Thank you.
Yeah, related to that, someone was just asking, you talked about doing hand washing demonstrations, but they're asking about the availability of, you know, the water jugs that you showed in the pictures and soap for program beneficiaries.
Yeah, water is a challenge in some of the communities. Some of the communities actually, when it comes to potable water, I mean clean water, they don't have. Even though government has done a lot in terms of providing a potable water in the communities, not all the communities actually have access to potable water. And so it's not like in places where you can always have the running water, but what we are educating them to do is to rely on the available water sources that are in the communities to do the hand washing. They cannot go beyond what they don't have. And so we are educating them to depend on the water sources they have. They would always fetch from those sources and then put them in containers. And of course, improvise Veronica buckets with which they can use to wash their hands. I remember in our training engagements, we realized that even soap for some families may be difficult. And so we are training them to use local, materials that are available that can be used in place of soap, to do hand washing, to ensure that their hands are clean from any infections. And I think basically this is what we are doing. It's really a challenge. As for the water part, it's a challenge, it's a serious challenge in some of the communities. Thank you.
Thanks, Isaac. We have one more question. Though if you sneak one into the chat, I'll probably take it. I wonder if you could maybe talk a little bit more about the food security situation in Ghana. Jeff is asking whether or not conservation agriculture is also something that's being practiced in Ghana. I mean, I know you talked a little bit about the food security situation during your presentation, but maybe if you could expand a little bit on that.
Yeah, as I indicated from the presentation, we are confronted with the issue of climate change in Northern Ghana. Climate change has affected a lot over here. It is affecting food production and is creating food insecurity. And so even though the government is having some programs in place through the Department of Agriculture, we have a challenge where because of the climate change, people are not able to produce enough. Because sometimes, food production in Northern Ghana is rain-fed, is dependent on the rain. And so we have, the rainfall patterns have changed. Sometimes they don't come at the expected time. When the rains come, sometimes they stop fast because of climate change. And temperatures are very high. So when you plant the crops, because of this, it will always affect, the productivity that you will get at the end of the day. And so it's actually a very, very, very serious challenge. But for us at the CBR, we have, through the support of PWS&D, been working, train our program beneficiaries, improved agricultural skills. And with that, they are able to produce enough food to feed themselves and their families. And because of what we are doing and the training that we are giving to them, it's not limited to them alone. There are other people who benefit indirectly. They benefit indirectly because they live in communities where persons with disabilities live. They are in homes with the persons with disabilities. And so the innovations that we are training them to use, organic fertilizers, the use of mulching, so that there will be moisture retention, even ensuring that we introduce improved varieties of crops and etc. The persons with disabilities who are beneficiaries, they are sharing the innovations with other persons in the communities. And so it is helping to improve the situation generally. It's helping to improve the situation of food security. I think what we will need to do is to continue. Once we continue to work, I believe maybe with your support, we will be able to gradually, have a greater impact in Northern Ghana, and for that matter, the whole country. Thank you.
Thank you, Isaac. Before we wrap up and before we say a final thank you to Isaac, I do want to just bring up one question that we had earlier from our earlier portion of the program. Someone asked about the situation with COVID in India. Obviously, it's a situation that's very much in flux, and just a little bit maybe about PWS&D's involvement in India. And I just wonder if maybe Guy could say a couple of words about that.
Sure. Obviously, the situation in India is getting totally out of control, and it's a big concern for the global community. As such, there's a lot of conversation in the works happening right now at Canadian Food Grains Bank, and likely an appeal that will come out very soon with the collaboration of the Humanitarian Coalition. So we're working on those aspects to generate resources that we can then use to support partners in India. With the ACT Alliance, a similar process is in the works. There are some meetings that are being planned for this week where people will come together and try to see what's possible and who has capacity to respond there. We have a partner in India, in Bihar, and we are also connected with CASA, who is all over the country. So we will definitely have opportunities to provide support in India. We're kind of gathering information at this point in time, but don't be surprised if soon enough you'll see some things coming out from PWS&D requesting funds to be able to respond there as things are getting totally out of hand.
Thanks, Guy. So we're gonna start to close off for the day. We're so grateful that Isaac was able to join us today, both that he spent quite a bit of time a couple of weeks ago recording his presentation because we weren't sure what his internet connection would be like today. We're grateful that it was so good so that he could answer so many of our questions. And we're just so grateful for your participation today. We know it's, early evening for you on a Saturday, and we're so glad that you could join us. I don't know if you had any closing words you wanted to share either, but feel free if you'd like to do that.
Okay, I would want to use this opportunity to express my profound gratitude to all of you, and particularly the entire PWS&D team, for the partnership and the support that we are getting from your end to be able to change the lives of persons with disabilities, and for that matter, the poorest of the poor here in Northern Ghana. I appeal that we need to strengthen this, and we need to do more work to continue to demonstrate the love of God to persons with disabilities in Northern Ghana. Thank you very much for the opportunity to be part of this conference. Special thank you to Christine. Christine has been very, very supportive. And then communications assistant, Clark, I did very well to be able to make it possible for me to take part in the conference and to make the presentation. But for the arrangements and the recordings that were made, I'm not sure it would have been feasible because of the way the internet is not stable here in Northern Ghana. So thank you, all of you. God bless you. We look forward to working together into the future to continue to change the lives of persons with disabilities in Northern Ghana. Thank you.
Thank you, Isaac. And just to say, if you have any questions that come up as a result of the presentation or anything that we talked about today, for those of you who were present at the earlier session, you can feel free to direct those questions to Emma or me or Stephanie, and we will get you an answer as best we can.